Good day, I am John Charles C. Sambile, one of the presenters of the importance and application of bandaging and massaging. A massage is a type of treatment that increases local and systemic blood flow that breaks down adhesions and facilitate lymphatic return. A massage has effects on our body. One of these is the reflexive effects, which is local effects on the sensory and motor nerves, and also the mechanical effects, which is on the surface adjustments in the myofascial structures caused by the direct force of the hand. The effects on our body includes reduction of pain, increased lymphatic and blood flow, reduced muscle tension, increased local metabolism, increased joint mobility and flexibility, body relaxation, drowsiness, and it also makes you calm. A massage is done to people with later stage of healing, chronic pathophysiological states, and also if pain, edema, and muscle spasm are present. When open wound, hemorrhage, active bacterial fungal infection, and acute inflammation are present, massage should not be done. These are the equipments that are needed enabled to proceed to a massage. A massaging table will be used, and this is where the massage will happen. Linens and pillows will be used to cover the patient's exposed skin and for comfortability. A massaging chair will be used if the patient found it hard to pronate or to lie down. Lubricant will be used on the patient, enabled to reduce friction. It is mostly on the form of oil, powder, or lotion. It is used when the patient's skin is too dry, a cast has been removed, scar tissue is present, and there is excess hair. A massage without lubrication will be done to reduce friction, and also if there is fragile skin, very hairy skin, and the gliding effect will be enhanced, and some oils can also aid in nutrition. A massage without lubrication will be done if the patient is allergic to some chemicals or when the friction massage will be done. 5 types of massage techniques: effleurage, pétrissage, friction, tapotement, and vibration. Effleurage, application of unbroken gliding movements that are repeated. Stroke may also be applied with hand or forearm. This is a sample video. As we can see in the video, the demonstrator is not lifting up his hands on the back of the patient and continually doing a gliding motion.
Towards the heart. Effleurage can be used as an introductory technique for touch, for spreading oil or lotion. The therapist needs to make sure that their hands are relaxed and flexible through the entire movement. You can also use effleurage as a way to introduce contact to a new part of the body or finishing strokes in different regions of the body. Another nice way to use effleurage is to take it as a transition between strokes. So if you were switching from tapotement to pin and stretch or any other technique, effleurage could be used.
Pétrissage is a cycle of rhythmic lifting, squeezing, and releasing the tissue. Typically follows effleurage. This is the sample video. Pétrissage is done with the help of the 4S: small, slow, specific, and S, circular. There are a lot of variations that we can use enabled to do this technique. First is the palmar with the use of the palm, and also thumb with the use of a thumb, the fingertips with the use of the fingertips. Next is the knuckles with your closed fist. And lastly, the open C or with the triangle palms. Friction massage is performed by rubbing one surface over another. It is also done without lubrication, enable to move the skin across tissue layers beneath the skin. In the sample video, we can see that the demonstrator is not doing any gliding movement and only doing it with his index finger while being reinforced by his middle finger. It can also be done with moderate or fast movement, but the pressure should not be released suddenly. Tapotment massage is a repetitive striking movement of the hand. It can be delivered using hands, tips of the finger, open palm, or cup hands. Tapotment massage should be done with light pressure and moderate strike speed, gradually increasing in speed and finally diminishing speed and depth. Stroke should be rhythmic, allowing hands to spring back. The main idea of tapotment is its rhythmic striking and springing back. This is the example of striking using the ulnar surface of the hand, and this is the pounding of the hand. Vibration massage is a rapid shaking, trembling, or rocking movements. Hands are always in contact with the patient. As we can see on the video, the demonstrator is not moving his hands and staying in one place. It can also be done with gliding motion while still trembling the hands. We can see that the wrist and the palm is straight, whilst the fingers is slightly adducted and the elbow is slightly flexed while still doing the trembling motion. Vibration massage is taking a lot of your endurance and strength. It is important to take breaks after 15 to 20 seconds of doing vibrations and then proceeding at it again. Myofascial release focuses on large treatment areas, a group of techniques that relieves soft tissues from abnormal grip of tight fascia. Treatment consideration for a massage. Duration for upper extremities, only 10 to 15 minutes. For lower extremities and the back, 15 to 20 minutes. For whole body, 45 minutes to 1 hour. For large joint, less than 10 minutes. For edema reduction, 5 to 10 minutes once a day. For friction massage, 5 minutes once a day. Rate of movements. For a soothing effect, we need to become slow, gentle, and rhythmical, approximately 15 strokes per minute. For a stimulating effect, we need approximately 30 to 90 strokes per minute. For age and size of the patient, shorter periods would be given to smaller patients, elderly, and very young individuals. Generally, a massage is given once daily. As patient's condition improves, frequency and duration is diminished. The type of movement is different to each patient and able to get the desired effect.
The importance and application, bandaging and massaging. What is bandaging? Bandaging contributes to recovery of injuries and must be firmly applied while still allowing circulation. When applied incorrectly, may cause discomfort, wound contamination, and prolonged healing. Purpose of bandaging: to immobilize an injured part and relieve pain, to support the wound and dressing, to immobilize a fracture or dislocation, to control hemorrhage, to improve venous blood flow from lower extremities by applying pressure, and the last, to reduce or prevent swelling. Materials for bandaging: gauze, sterile pads for wounds, roller bandages to hold dressing in place, padding to prevent blisters, and cotton cloths, ankle wraps or triangular bandages. Elastic bandages, extensible and very useful with sports. Active bandages allowing for movement, provide support and compression for wound healing. And cohesive elastic bandage, 2-layer self-adhering bandage and exerts constant and even pressure. What is elastic bandages? Elastic bandages contains fibers that allow it to be stretched. Should be stored rolled, should be free from wrinkles, seams and imperfections that could cause irritation. Length and width vary and use according to body part and size. The length is 6 or 18 yards and the width 2 to 3, 4 or 6 inches.
How to apply elastic bandage. Number 1. Hold bandage in preferred hand. Number 2. Loose end should extend from bottom of roll. Back surface of loose end should lay directly on skin surface. Number 3. Pressure and tension should be standardized. Number 4. Anchors are created by overlapping wrap. Start anchors at smallest circumstances of limb. Number 5. Body parts should be wrapped in position of maximum contraction. Number 6. Each turn should overlap by half to prevent separation. More turns with moderate tension, fewer turns with maximum tension. And last, circulation should be monitored. Spica, a bandage wrapped in a figure 8 pattern with one of the loops being larger than the other. The spica is also used on different techniques of elastic bandaging like ankle and foot spica, spiral bandage spica, hip spica, shoulder spica, elbow figure 8, hand and wrist figure 8, and ankle wrap. What is triangle bandage? It is first aid device. The application is easy and fast and primarily used for slings. A sling is a device used to support and keep still or immobilize an injured part of the body. Slings can be used for many different injuries. They are most often used when you have a broken or fractured or dislocated arm or shoulder. Different types of slings. Number 1. Cervical arm sling. Provides support for forearm, wrist, and hand injuries. Bandage placed around neck and under bent arm to be supported. Number 2. Shoulder arm sling. Utilized following injury to the shoulder girdle. Provides support for the forearm. May be used if the cervical arm sling is causing irritation. Number 3. Sling and swat. Combination of cervical and shoulder arm slings. Provides support for the upper extremity. Uses in instances of shoulder dislocations and upper extremity fractures.